So what are the average out-of-pocket costs that caregivers spend on their situation of care? AARP reported in 2019 that family caregivers spend, on average, about $7,400 of their own money on the situation of care they're managing per year. If the recipient of care lives more than an hour away from the caregiver, the cost went much higher, closer to $12,000 per year. Wow. How was that money spent? 41%, or more than $3,000, went toward household expenses. That's making mortgage and rent payments. It's modifying a home to accommodate difficulty getting around. It's installing remote health and safety monitoring devices. 25%, or around $1,800 of that annual total, was spent on medical expenses. That's doctors, hospitals, and prescriptions. It's medical equipment like wheelchairs or oxygen concentrators or hearing aids that help make daily life more bearable. And it also includes the travel necessary to get the recipient of care to and from a doctor's office or clinic. 14%, or around $1,000, was spent on personal care items for the recipient of care. Clothing, incontinence supplies, toiletries, even included there is pet care. And 12% of the total, or about $900, was spent on traveling to provide the care, or retrofitting vehicles to accommodate wheelchairs, or consultations with outside experts like lawyers or educators or others. 8%, or around $600, was spent for outside help. That's assistance with respite care, including adult daycare, counseling. Geriatric care managers and hired companions are in that category as well. That's a lot of money, along with all the time that we talked about to learn, acquire, and coordinate those expenses and services. We have got to find a way to get our arms around our financial and career health. It can take a huge toll on our lives. So, as we mentioned earlier, we're going to talk about this in two categories. We'll start with that box on the left, strengthening caregiver financial health, which we'll explore in our next lesson.